Hello friend, welcome to the channel Pharmacy Dictionary. We are studying about the pharmacokinetic. What is pharmacokinetic? Pharmacokinetic is study about what does body do to the drug. This is called pharmacokinetic, and under this pharmacokinetic we should study about the ADME. And you know it very well that we have completed all these three parameters A, D and M. Now it's time to study about the last one, that is E, and E is abbreviated for excretion, or we can say excretion of the drug. So first of all, we must know what is the meaning and definition of excretion of any drug. Excretion is nothing but a process of removal of drug without being metabolized or its metabolite. That metabolite may be active or may be inactive, whatever it is, that should be a metabolite. So this excretion of the drug and metabolite from our body, from blood, is simply known as the excretion, and the process is obviously known as the excretion of the drug. There are so many ways or paths by which any drug get eliminated from our body. These are generally urine, feces, sputum, saliva, milk, sweat, sperm and etc. Sebum gland can also be included under this category, but these are not as important as the urine, feces and saliva and milk somehow. So these were the route of drug excretion. Now we should study about the basic parameter regarding the excretion of any drug. ADME is very important, but E is most important, I must say. This is my personal belief. Why? If you are taking any of the drug, so the drug has chances to produce its therapeutic effect or unwanted effect. What will happen if the unwanted effect or the metabolite of the drug will not be eliminated from your body, will not be excreted from your body? That will be converted into a accumulation effect. So all the drug, either it is metabolized or not metabolized, or its inactive metabolite or its active metabolite, whatever it is, they will be remain in our body for longer duration of time, and that is a problematic condition. So this is very important for our body, for the safety point of our body, that our body should excrete all those things from our body so that the cleanup process can be achieved. This is very important regarding the excretion concept. So as per the standard definition, how we can define the excretion? Excretion is a passage out of systemically absorbed drug. This is called excretion. What is the meaning of systemically absorbed drug? Whatever the route of drug administration is, most of the cases different barrier through the drug came to the systemic circulation, that means blood. So the excretion of drug is representing the passage of drug from that absorbed part portion, that means from blood throughout the urine, throughout the feces or whatever the excretion route is. So removal of drug from blood is simply known as the excretion. So drugs are excreted from body after being converted to more water soluble drug, more water soluble metabolite, we may say. As we have studied in case of metabolism, metabolism is a process of conversion of lipid soluble drug into water soluble drug or more polar drug. Then only our body can eliminate this, can excrete it via the urine. So this is important process. In most of the time, the drug get excreted after its metabolism, but it is not necessary and it is not compulsory. That's why this hash mark is represented here. Somehow, sometime any drug can excrete it without going through the metabolism. This is also applicable. So now we should study about the route of excretion. What are the basic routes? What are the basic way by which any drug from the blood get excreted from our body? This is just like a route of drug administration, but the opposite thing is that in case of route of drug administration, we have to study about all those routes by which we can administer the drug so that the drug may go through systemic absorption and should show their pharmacological effect. But in case of the drug excretion, the process is opposite. What are the possibilities for the drug so that they may get excreted from our body? This is the difference between these two terms. So what are the routes? These are urine. Most of the important route of drug elimination is urine. Then after feces, exhaled air like volatile substance, that will be excreted from exhaled air. Next one is sweating. Next one is saliva, milk, sperm, etc. In some book, the sebum gland also included under the route of drug excretion, but that is not as important like this other route. So we will come to all route one by one. So the first one is renal excretion, or also known as the excretion of drug via urine, because here renal part is involving in the excretion part. What is the renal? Obviously your kidney, and the structural functional unit of kidney, that is nephron. So what is the importance of this route of drug? Elimination, excretion. This is most important route for the drug, and this is applicable for those drugs which are water soluble substance. That means after metabolism the drug should convert it into water soluble metabolite, so that only those drugs can get excreted from the urine. This is important parameter. Now we have to study about the other one, that said net removal of excretion. How much and how the drug get excreted from our body with the help of urine. So we can say net removal excretion, net removal of drug with the help of nephron, or net removal of the drug via the urine, or simply net renal excretion, we must say, is defined as a simple formula. This formula says glomerular filtration plus tubular secretion, and the plus of these two terms, two processes get reduced, that minus subtract by the tubular reabsorption. This is a simple formula to calculate net removal of drug from urine or net renal excretion. We can term both this. So this is a simplest formula. Let me clear you the example of some random calculation. So we have to calculate the net renal excretion. The formula is, just for example, the glomerular filtration is 50 ml. Tubular secretion is 10 ml. Just for example, random figure is that if we combine this, if we add up these two terms, there will be a 60 ml minus the tubular reabsorption, that let us assume 5 ml. So what will be the final value? 50 plus 10 is equal to 60 minus 5 is equal to 55 ml. So the 55 ml is the net renal excretion. Just for example. So this is very important. Now let me explain you what are the basic consequences of urine formation. Then only we can understand how the drug will get excreted with the help of urine. So this is the functional and structural unit of kidney, that is called nephron. Nephron has basic parts. I am not going to that much detail because it is not anatomy part, but few important parts are Bowman's capsule, proximal converted tubule, loop of Henle, it may be either ascending loop of Henle or descending loop of Henle, and proximal distal converted tubule. So this is DCT, proximal converted tubule, distal converted tubule, and at the last collecting duct. These are the basic part of a nephron. The formation of urine took place by the help of three main steps. These three steps are, first one is filtration, the second one is secretion, and the last and the final one is selective reabsorption. As in case of formula, you have seen this value. So what are the process? These are the blood containing different metabolite or containing other type of impurity or toxic material. So this blood is coming throughout the bodies to the filtration site, that is a nephron, so that may filtered and the rest of inactive material or non-useful material get eliminated via the help of urine, and those which are useful but by mistake they went to the lumen, they may get reabsorbed. This is the basic principle of the urine formation. So the blood is coming to the Bowman capsule. Here in this Bowman capsule there are some specific pores. Usually the pore size of Bowman capsule is larger than the other one. So what is going to be happen? This is the clumsiness of the blood vessel which make a structure like a wool. So what is going to happen? The drug or the metabolite or any other toxic substance which are available in the blood get filtered through this filtration process. This is called Bowman capsule filtration process, or simply the first one is filtration. So via this pore the drug will come out to the lumen of the nephron, so that they may pass via the lumen, and ultimately via the lumen they will travel through the Bowman through the collecting duct, and from the collecting drug they will get eliminated as a urine. This is a process, but this process involved two other processes also. The first one was filtration, as we have seen in this case. The first, this is indicating the filtration process. Now second one says the secretion. Secretion means those macromolecular substances, either a protein or somehow medicine like penicillin, cannot be filtered through this Bowman capsule. So they will secreted through the lumen, to the lumen by the blood vessels, so that here you have to see this movement of arrow. The arrow indicate movement of those drug or those substance from blood to the lumen. That is called secretion. And the third one is selective reabsorption. If our body think that mistakenly something is getting eliminated or it is to be being eliminated, so that we try to reabsorb it. That means the movement of those agents from the lumen to the the blood, that's called reabsorption. As the name indicate, reabsorption. Absorption is already being take place with the help of blood, but now after excreting to the lumen, it is getting reabsorbed. Wow, it is getting absorbed again. That is why it is called reabsorption. So the third process is reabsorption. As you can see, the movement of arrow from the lumen to the blood, this is called reabsorption. So these three are basic steps for the urine formation. Now let me explain you the process of this urine formation, very important point, one by one. So first one is glomerular filtration. As its name indicates, filtration, that means separation according to their size. That means those things which are in higher molecular size cannot be filtered, but those which are smaller can be filtered. This is a basic principle. So what are the basic points under this Bowman capsule filtration? These are have pores larger than the usual. These are having pores, as I have shown in this diagram, larger than the usual one. Second one say non-protein bound drug, either it is lipid soluble or water soluble, are filtered. Only those drugs metabolite which are non-lipid binding, non-protein binding, can only be filtered through this Bowman capsule or this part of process of filtration. Next one say the glomerular filtration depends on the filtration process via the glomerular filtration depends on plasma protein binding and the renal blood flow. As I have indicated the first one, if the drug is having plasma protein binding, that will be act as a macromolecule. That means a drug which is plasma protein binding will be have like a macromolecule. The size is larger. So that cannot be filtered through this pores, usual pores. That is important parameter. And the second parameter which govern the filtration process is renal blood flow. That means how much volume of blood is coming through the filtration. If the volume of blood is higher, the filtration rate will be obviously higher, but if the blood volume is very low, the filtration process will also be low. So that we can calculate the GFR. GFR stands for glomerular filtration rate. That means filtration of blood per minute of time or per unit of time. That is called GFR. This is example of very important. The question must be asked in your sessional examination. So the formula of GFR is approximately 120 ml per minute. This is a random value, and that is decreased after the passing of age of 50 years, and that will progressively decrease too. So this were first point regarding urine formation. Let's move to the next one, where we will study about the secretion process. So let's coming to the secretion process, we should go for the next whiteboard section. Please be with us. Coming to the next process of urine formation or the excretion of drug is tubular reabsorption. This tubular reabsorption is made of two important words. The first one is tubular and the second one is reabsorption. And if you would like to bifurcate this word reabsorption, simply we can split into re plus absorption. Here re means again, that means it's taking place once again after it has been already completed, and the reabsorption means you know it very well. Reabsorption is a process of movement of drug from its site of administration to the systemic circulation, that means some blood. But in this case we are not studying about the absorption, we are studying about the reabsorption. So there are three steps for the absorption of drug, and in case of reabsorption is also applicable, but one more step is add up. First of all, whenever we take any drug, that drug from the site of administration, it may be oral or IV or IM or SC, anything it could be. So from the route of administration or site of administration, that will reach to the blood circulation. This is the first absorption. From blood, now after reaching to the blood, it will try to distribute throughout the body, and at the last of ADM, the drug will try to eliminate itself via the urine. So they come to the glomerular filtration, and finally it comes to the lumen of nephron. Now again in the process of reabsorption, the drug which came to the lumen of the nephron go back or diffuse back to the tubular, that means blood vessels. So this is taking place after the first absorption. So that is why it is called as a reabsorption. That means absorption which is taking place at a second time. Already first time it has been absorbed by the oral route or any other route, but now it is absorbing from the lumen to the blood vessels or tubule. That is called reabsorption. One more thing I would like to add in this explanation, because this is very important. In case of different types of diuretic, the process of reabsorption is hindered by them. So diuretic case is very important, where the reabsorption process is a rate limiting for the formation of urine. If the reabsorption is taking place much amount, the volume of urine will be controlled control. So if you want to reduce the reabsorption as a diuretic effect, then most of the drugs should affect this process of reabsorption. So this was basic introduction regarding tubular reabsorption. Now what are the basic points which may govern the process of reabsorption these are occurred by passive diffusion. In case of movement of drug across the cell membrane, we have studied about the different movement parameter including active diffusion, passive diffusion, carrier mediated diffusion, pedocytosis, phagocytosis, including exocytosis and endocytosis. So these were the process for movement of drug. But now we should study about the passive diffusion, which is followed by the tubular reabsorption. Passive diffusion is a type of diffusion where molecules move from their concentration gradient that does not depend on the energy, that is energy independent. So this is called passive diffusion. The tubular reabsorption process also depends upon the lipid solubility along with the ionization of the drug at the existing pH. So I mean to say existing pH, that means the pH of urine which has been formed just after the filtration process. So what is the basic factor, governing factor which may affect the rate of reabsorption or lipid solubility? We have studied in the previous section that the drug, either lipid soluble or water soluble, may filter with the help of Bowman capsule. So they may filter and they call as a filtrate. So they depend upon this lipid solubility as well as ionization. I will explain you how they affect the process of reabsorption. Coming to the next point, that is second point, says lipid soluble drug filtered at the glomerular back diffuse in the tubule. Let me clear a point with taking a pause. So lipid soluble, which type of drug? Drug which are soluble in lipid, which already filtered by glomerular filtration, that get back diffused to the tubule. That means if the drug is lipid soluble and has been filtered by the Bowman capsule or by a filtration process, that will go back or diffuse back to the tubular, that means blood vessel, which has been important for the circulation of drug along with the blood molecules. So they will go back, but it is important, but non-lipid soluble and highly ionized drug cannot do that. That means only those drugs which are lipid soluble can go for the reabsorption process, but those who are having non-lipid soluble or having high amount of ionized condition, they will not go back, they will not diffuse back to the tubular. So this is free from reabsorption process. Let me explain you the process of reabsorption with the help of rough diagram. Here I have plotted two diagrams. The red one represents blood vessel or tubules and the blue one is for lumen of the nephron. In case of reabsorption, first of all we should know about the process of movement of drug in lumen. So after the filtration with the help of glomerular filtration or Bowman capsule, those drug will come to the lumen of kidney. So now there are two types of drug present in the lumen of nephron. These are either in green color or in black color. The green color represent lipid soluble drug and the black color represent non-lipid soluble drug as well as highly ionized drug. And you know it very well, the condition for the reabsorption, only those drugs which are lipid soluble can be reabsorbed. So here reabsorption will be taken place for the lipid soluble drug and that are represented in the green color. So here you can see from the lumen to the blood vessel, only this green color dot, that means lipid soluble drug, are going back. That is called back diffusion. So this process is called reabsorption. Why reabsorption? Because absorption is already taken place with the help of first process of absorption of ADME from the route of administration to the systemic circulation. So this was first absorption. This will be called as a absorption. Now after coming from the blood to lumen, the going back process is taking place again. So this is second time where the absorption is taking place. That is why this is called reabsorption. So coming to the next important parameters, say change in the urinary pH affect the reabsorption of drug that are partially ionized. As I have explained you the existing pH, so the pH of urine is very important, not only from here or excretion point of view, not only for the ADME point of view, but whenever we will study about the antibiotics, the role of antibiotics will also be influenced by the urinary pH as in case of UTI, urinary tract infection. So what are the consequences, what are the possibilities of their reabsorption? So these are first point set, this is very important, please pay attention on this whiteboard. Weak base ionize more. See, weak base, we are talking about the base which is weak in nature. Weak base ionize more, and we know it very well, ionized drug cannot be reabsorbed. So weak base ionize more and less reabsorb in acidic. Obviously you can see in the board. So weak base ionize more and less reabsorb in acidic urine. If the pH of urine is slight, that means in an acidic condition, so the weak base will not be reabsorbed in a good quantity. Same as in case of base, but see here weak acid, now in place of base this is acid, so weak acid ionize more and less reabsorb in alkaline urine. Both are vice versa for each other, so you should remember this point, this principle, because these are the governing principle for basic treatment in case of poison or any other route where you have to eliminate the drug from your body as faster as possible. So this is important governing factor. So here we have included a note says this principle means this two, weak base ionize more and weak acid ionize more and reabsorb less respectively in acidic and alkaline pH. So you should remember this point. This principle is utilized in the case of poisoning just to eliminate the drug from the blood, because they are poisonous in nature. We should eliminate it as soon as possible, and we have to reduce the reabsorption. So if you want to reduce the reabsorption, that is less reabsorption, accordingly then you should follow the parameter. You should change the pH of urine too. So this is example, urine is alkalinized. Basic thing is out there, urine is alkaline in barbiturate and salicylic poisoning. If you want to clear the poisoning of barbiturate and salicylate, then you should convert the urine pH into alkaline, because in case of alkaline their reabsorption will be less, as you can see in these two principal points. Coming to the next, that is the next process of urine formation, but that is not as important as case of filtration and tubular reabsorption, so I have included in a very short manner. That is tubular secretion, those drugs which cannot be filtered by the glomerular filtration that came to the lumen of kidney or nephron with the process or with the help of process of secretion. So this is called tubular secretion, that is secretion taking place from the tubule, that means blood vessels toward the lumen of nephron. See here, active transport principle is followed. So active transport of organic acid and base is taking place here. There are two pathways. The first one says for organic acid transporters. Organic acid transporters means the basic pathway followed by here. This is through the OAT, that is full form of OAT is organic anion transporter. Those are organic, those are anionic, get transported by this pathway. So only examples are here. Example of drug which follow the organic acid transporting system are very important. These are penicillin, probenecid, uric acid, salicylate, indomethacin, methotrexate, and those drugs which follow the organic base transport system through the OCT. What is the meaning of OCT? That is organic cation transport. This where the OAT means organic anion transport, whereas OCT represent for the organic cation transport. Here example of drugs are thiazide, amiloride, furosemide, quinine and cimetidine. These drugs follow this pathway. So in case of tubular secretion, the examples of drug by their pathway is very important. Nothing is as important as case of this tubular secretion. So friend, this was the route of excretion of drug is with a specific reference to the renal route of drug elimination, because this is one of the most important route for the elimination of many of the drugs. So in our next video we will study about the remaining other drugs, remaining other routes by which drug can get excreted. So at last, thank you very much for watching this video. The reference for today's topic is KD Tripathi and Padmaja Uday Kumar. So if you do not have any of this book, don't worry, we will give you the time to take a screenshot. You will have a screenshot after some time. Thank you very much, and please do take care of yourself. One more request I would like to say with you, that please give us feedback in comment box after watching this video. Thank you.